The client, as seen in the video right now, is assessing the ankle dorsiflexion. The first two tests being the passive mobility of the right foot and the left foot. The results are 9 cm for the right foot and 10 cm for the left foot. And then the professional will help the client on the active mobility test, pushing on the knee and applying extra pressure, which results in a massive change in the distance, increased to 13 centimeter for the right and 14 for the left, by 4 centimeters in total for each. The second test will be the shoulder flexion. It will be assessing the shoulder mobility of the client. The client fist of the test arm O crosses C7 for the cervical vertebral for both right and left arm. And the professional helps the client through the process. The results have again significantly increased from the previous test, estimated to be about 14 centimeters, exceeding the C7. The third test is the hip flexion test. The client will be lying on the ground first and raise up one of his legs, and then put it down for the passive test. The professional will help the client achieve on the active mobility test. The client and the professional will counter each other's force to activate the client's muscle, and then when the client relaxes, he can achieve more range of motion because the muscle has deactivated. The results of this test are 60 to 70 degrees for the passive test on both legs, and 80 to 90 degrees for active test on both with the professional helping. Lastly, the client will challenge himself on the balance and joint stability test. One being on a position of a one-hand push-up, and the other one being on a one-leg standing position. And the professional will measure the distance the client is able to reach on both tests, using the tape grid on the floor as a reference. For this particular test, there are many limiting factors: the joint mobility, ankle, wrist, shoulder mobility, strength, coordination, height, and arm and leg length are all a limit for this performance. The more increase in these variables or limiting factors, the more distance the client is able to reach. And the results of these two tests are here.
Different mobility modes of client when doing active and passive will affect the final result. In our test, activate mobility, the client can achieve higher results than in passive mobility. Active mobility refers to the range of motion in a joint that is achieved with external force or assistance without the individual's voluntary muscle activation. Passive mobility, on the other hand, refers to the range of motion in a joint that is achieved through voluntary muscle contraction and the individual's own effort. In many situations, a combination of passive and active mobility proves to be most effective. For instance, early rehabilitation might initially rely on passive mobility to facilitate joint recovery, and then gradually introducing active mobility to enhance muscle control and stability.
In my opinion, the client's mobility influences their web balance test result according to the result from the assessment, as the test involves joint flexibility, ankle wrist shoulder mobility, strength, coordination, and high arm length. These factors all limit the performance. The more increase in these variables or limiting factors, the more distance the client is able to reach. This is being reflected as the client has a higher result for his left side than the right side in the Y balance test, with 7 centimeters further in both posterior medial and posterior lateral, and 4 centimeters further in the composite. The client done the right side first, which increases his mobility, thus he will perform better in his left side test.